Welcome back to the fifth class of this week. Today we will be sharing two interesting murder stories. One which took place in 1950s in UK. The next one is more recent in 2001, between 2001 and 2005. The first story was the story of Kenneth Barlow. Kenneth Barlow is the first documented murder using insulin. So, if you have to understand insulin, then the best way to understand insulin is this situation when I mention what will happen in your body if your body is low in glucose and I give you insulin doses, how it is going to affect. Well, logically speaking, what insulin will do under that situation is whatever residual glucose is there in your body, it will absorb that glucose from the bloodstream. So, in a way, your body will be devoid of minimum level of glucose and you will start to feel tired or you may even faint. There is every possibility that you may faint because you do not have any running capital of basic glucose in your body because you have been given excess insulin and that excess insulin has helped those cells out here. Say for example, just forget it's not a diabetic, it's a normal situation, think of it. So, if you put excess insulin, it will take care of all the glucose from the body and you may get faint. So, keep this in mind while we will talk about the story of Kenneth Barlow. So, now I take you to the year 1957 and 1923 is when the Nobel Prize was awarded in insulin to MacLeod and Banting. On the morning of 4th May 1957, just after 2 a.m. early in the morning, Dr. David Price, a forensic pathologist, was called to the home of Elizabeth and Kenneth Barlow in a residential suburb of Bradford, Yorkshire. The story was that Kenneth Barlow had discovered his wife unconscious in a bath at about 11:20 p.m. the previous night and called his own doctor, who diagnosed her as dead. Kenneth, a 38-year-old state-registered nurse, was unemployed. He had married Elizabeth 11 months earlier and was, to all outward appearances, living happily with her and his 10-year-old son by his first wife. So, he figured out this wife has died in a bathtub and he called the doctor. Doctor diagnosed her that she died in the bathtub, but then he had to call the forensic expert that there is no foul play. So, Barlow called the forensic expert and the forensic expert came at 2 a.m. Okay. Now, what happened? According to Kenneth, Elizabeth had tea at 5 p.m. on the evening of her death. Shortly afterward, she announced that she was tired and went to bed. When Kenneth came to bed at about 9:30 p.m., he found that Elizabeth had vomited on the bed. Together, they changed the sheets. She put on some pajamas, but took them off because she said she felt too warm and decided to take a bath. Kenneth lay on the bed and went to sleep at about 9:45 p.m. to the sound of bath running. When he woke up at 11:20, as I mentioned, it was at 11:20, the previous night he called his own doctor. 11:20, Elizabeth had not returned to the bed. When he went to the bathroom, he found her submerged beneath the water. He tried to lift her out but did not have the strength to do so. Nevertheless, he held her head above the water until all the water had run out of the tub. He said he then tried artificial respiration by pressing on her abdomen as he was unable to lift her from the bath. Only after this was unsuccessful did he run next door to his neighbor who had a telephone and asked them to call a doctor. And this is where the family doctor came and declared her death. The family doctor arrived in 10 minutes later and found Elizabeth in an empty bath in a position simulating natural sleep. He did not touch her beyond ascertaining that she was dead. With such an unexpected death, he felt it's necessary to call the police, who in turn called Dr. Price, who was on call as home office forensic pathologist. His main job was as a consultant pathologist at the nearby Beckett Hospital in Barnsley. Dr. Price suspected from the beginning that this was not a natural death for two reasons. First, now this is a very interesting part. 11:20 is the timing of death. The forensic expert coming at 2 a.m. and forensic expert was not at all convinced that this is a regular death. The first death from drowning in a domestic bath is a previously perfectly healthy 32-year-old woman is rare. Second, but even more telling was 110 ml of a small cupful of water that remained in the cavity where the crook of Elizabeth's arm abutted the side of the bath. This made Kenneth's story that he had tried to resuscitate her difficult to accept, and consequently his account of the event suspicious. Meanwhile, the police had made a thorough search of the house and uncovered nothing very much except two vomit-stained pillowcases in the bathroom wash basin, a set of sweat-drenched pajamas in the bedroom, and a couple of used syringes in the kitchen. Because of the latter, the police searched the house for vials of insulin or other injectable medication but found none. So there was nothing. Dr. Price began the post-mortem examination in the local mortuary at 5:45 a.m. So 2 a.m. he was called. This is 5:45 a.m. early morning, 3.5 hours after the first. So whenever we are talking about forensic and murders, you have to realize the time when you are doing the examination, because the time is very important when the real recordings were made, because by that time the compound has deteriorated over a period of time in a dead body. So unless you have the exact recording of the time and the data you are obtaining, you cannot say things with certainty. And most of these murder cases has this kind of problem because the compound gets deteriorated in the body. So Elizabeth's body, and 6 hours after she had died, he noted that her pupils were widely dilated. This is one of the symptoms, and that there was blood-stained froth in her nose, mouth, and throat. Samples of her lungs, when examined under the microscope, were bulky, congested, and wet. They also revealed fluid retention in the small hemorrhages, confirming the initial diagnosis of death by drowning. Apart from this, he found no abnormalities but did observe that Elizabeth was 8 weeks pregnant. In addition, Dr. Price took the precaution of collecting the blood sample from a number of different sites of the body, as well as some urine from the bladder, to send to the poisonous laboratory just in case she had been poisoned. The samples were examined by Dr. Alan Curry in Northeastern Forensic Science Laboratory, who went on to become one of the most distinguished directors of the UK's nationwide forensic science services. Dr. Curry found none of the common poisons or abortion causing substances in any sample he examined. Nevertheless, Dr. Price and his senior police colleagues remained convinced that Elizabeth had been rendered unconscious before she drowned, and that considered the possibility that she had been injected with insulin. This would explain her excessive sweating, as I was mentioning, and dilated pupil before the death. So 4 days later, this is all happening in we're talking about the time of 1957. 4 days later means May the 8th. Okay. 4 days later, on 8th May, the decision was made to re-examine Elizabeth's body more thoroughly and under the bright light. On this occasion, with the benefit of magnifying glass, 2 hypodermic injection sites were identified in each buttocks. Dr. Price removed these with their surrounding tissues and stored them in refrigerator until he could find a scientist with the expertise and facilities to undertake an insulin test. 1957, mind it. Okay. The methods available at the time were comparatively crude by today's standard and could only be performed by a handful of specialist laboratories. They relied on the findings, the dose that caused hypoglycemic convulsion. Hypoglycemic convulsion is when you are completely removing the last trace of glucose from your bloodstream by injecting insulin in mice and comparing the sample with standard samples containing known amount of insulin. It was the method used at that time to measure the strength of pharmaceutical insulin extracted from animal pancreas before releasing it to be used by the patients. Dr. M.R. Gard, the research laboratory of Boots Drug Company, which was one of the 3 British manufacturers of insulin at that time, undertook to perform the test. Dr. Gard did not, however, hold out much hope of success, mind you, because he was not very sure, because from a dead body you are removing certain part of the tissue where you saw a hypodermic needle and you believe that there will be some insulin trace. That's kind of a pretty, like, you really have to be extremely hopeful that it is going to work. He thought the technique might not be sensitive enough to detect the small amount of insulin that he would find in the tissues of someone who had received an insulin injection. However, Dr. Gard did find easily measurable quantities of insulin extract of the tissues taken from Elizabeth's buttocks. For comparison, Dr. Price had removed the tissues from other corpses which Dr. Gard treated in the same way. As he expected, he found no traces of insulin in them. The findings from Elizabeth's were clearly abnormal and therefore highly suspicious. Thereafter, other tests were done, which I am not narrating here, using other techniques like ELISA and RIA, but this was a catch. This was what was believed. On 5th July, 2 months after Elizabeth's death, Dr. Gard reported that he had been able to recover from 3 separate samples of Elizabeth's buttocks a total of 84 units of insulin, enough to keep 2 insulin-dependent diabetic patients going for a whole day. Elizabeth did not have diabetes, nor had she been on any prescribed insulin. Elizabeth was not suffering from any such disease like diabetes. She was pregnant, that's true, but not diabetes. Then why there is 84 units of insulin in her body? And specifically at the site where you see the injection, there is a puncture and you take the tissue and find insulin in the system. This was good enough reason at the time. On the basis of this evidence, Kenneth Barlow was confronted by the police on July the 26th, whereupon he admitted injecting Elizabeth but not with insulin. He said he had, with her permission and collaboration, injected her with ergometrine, a drug used legitimately in obstetrics at the conclusion of delivery and by lay people when they could get hold of it to try to induce an abortion, and which was clearly illegal. He was unaware, so this is the part he was unaware, that this possibility was already ruled out by the investigating officer by the toxicological examination conducted by Dr. Curry on Elizabeth's body immediately after her death, and subsequently by examination of the needles and syringe found in the kitchen. The jury found Kenneth Barlow guilty on the evidence, and Mr. Justice Diplock sentenced him for life imprisonment on 13 December 1957. He was released from prison 26 years later, 1984, and is still maintaining his innocence. So many things we'll never come to know. But what we know, although usually described as the first case of murder by insulin to lead to conviction, Elizabeth Barlow did not in fact die of an insulin overdose, although it played a crucial role in her death. The amount injected into her body was sufficient to render her unconscious, because you have no glucose in the body. Whether she would or would not have died had Kenneth left her long enough will never be known. It is probable that he had expected her to die more quickly than she did, and so he made the decision to drown her, which he did. Had he left her in the bed, she might well have been dead in the morning, or at least have suffered irreversible brain damage, and all of the insulin he had injected would have been absorbed into her bloodstream and destroyed. There would have been no smoking gun for the pathologist and toxicologist to find. There would have been no case against him. So, this was one of the very sorry deal of insulin misuse. And as it is being said that if you would have allowed her to die just out of insulin, she would have suffered from either irreversible brain damage or would have died out of sheer lack of energy. And there would not have been any trace of insulin, because by the time all the insulin would have been consumed by the body. But getting 84 units of insulin in your body raised enough suspicion and smoking gun for the pathologist that how come this got into it. Well, many things will never come to know. What really and why really Kenneth Barlow did it. There are a lot of psychopathological aspects to it. We really do not know. But this is, in the history of humankind, is the very first case where somebody has been convicted for murdering using insulin. And the next case is Colin Norris, and this is a serial killer and insulin murder and a case of Colin Norris. This is the present time case. Colin Norris is, all of you can really go through, this is in last 24 years this case is going on. Overdosing with insulin causes hypoglycemia, as I mentioned, irreversible brain damage and death. Elderly and frail patients are at risk of suffering spontaneous hypoglycemia. Insulin has sometimes been used as a murder weapon. The insulin C-peptide concentration in the plasma is used as a biomarker for insulin overdose. So, this is, we'll be talking later about this part, insulin C as a biomarker for specifically for sensor development. The strength and weakness of the evidence used to convict Colin Norris are under still review. So, that this is what I am talking about is 2001, 2005, 2008, the multiple serial killing by Colin Norris, or at least this is the current verdict. So, if you look at it, 1957, 2008, and of course, the insulin story of 1880s to 1923. So, if you look at it from the scientific perspective, it is a story of lot of drama, lot of human agony. From the perspective of forensic, is a story of more gory sagas, and which have kind of, on one hand, have improved the forensic understanding of insulin. On the other hand, it has opened up a whole new array of questions that how a molecule like insulin could be used as a potent agent of death which is produced. So far, that was the reason why I picked up this thing. We talked about microbes, virus, bacteria, and now we talked about a molecule which we produce. And now there are a lot of sensors which are coming to inject insulin into your blood, especially these are all miniaturized sensors for diabetic patients. But I believe we'll learn more and more about how these kind of molecules play a critical role and multiple functions in our body in the years to come, and how different kind of more potent sensors could be developed for insulin and other such molecules. So, with this, I'll close in this class with the hope that you guys explore more and more about these kind of molecules. And there are a lot of very interesting stories, real life stories, which have changed the way we think and help us to realize the power of different compounds and how they have shaped up our biosecurity. Thank you.